Hello.
Hi, Dr. Maria. I've sent you a request if you can join it.
Yeah, sorry. Let me just figure out my phone situation.
Hello.
Yes. How are you doing?
I'm very well. How are you?
I'm also good. Good, alhamdulillah. Just prepping for Karachi Wellness Festival that's about to happen. So very
Oh,
excited for
right.
that.
When's that?
Yeah. So that's happening 4th to 5th February, and there's going to be a bunch of different sessions um, on. Sorry, let me just figure out my internet. There's going to be a bunch
Video
of.
is perfectly fine, हाँ. आपकी
Oh, okay.
आवाज भी सही आ रही है, वीडियो भी आ रही है.
Oh, okay, perfect. So there's just going to be a bunch of different sessions on body awareness, on emotional health, on the link between the body and the mind. There's going to be yoga and fun activities and food and things. So it's happening 4th and 5th February, Veritas Learning Circle pe. Um,
So,
yeah.
Veritas is like a primary school, if I'm not wrong, right?
Yeah, so they are a primary school and they have a very mental health and social emotional learning aware sort of focus to education. So they also then do this on the like a yearly basis. Yeah.
That's very cool. Very cool. Shani, let me introduce you a little bit. We have 14 people who have joined in. Just the most people we've had joining in, like, right at the starting.
That's amazing. I
Over
hope they're not
time, वो बढ़ता
expecting too much, too many answers. We don't have that many.
So, Dr. Maria and I, we worked together at AQ, and Dr. Maria is a AKU graduate, and after that, she did her master's in public health from Harvard, and she then coming back, she did a few other projects we'll talk about, and then currently, she's working in AQ with us under the non-communicable disease department, and she's working in the mental health section of that. So yeah. Okay. Right. So let's
Thank
get
you
started.
for having me on, and yeah, just thank you for bringing me in for this. It's such an exciting initiative that you're doing, and like I wish I had something like this to help decision make when I was a student.
Definitely. And you know, like, लोग इतने हैं, लेकिन there is no connection between, you know, just students who want to actively learn about public health but have no idea who to go to. So yeah, for sure. You know, I'm glad. I am sure that you will give a lot of insight to a lot of people today.
We'll see. We'll try.
So मुझे ज़रा अपना background का थोड़ा बताएं, you know, starting from your schooling till graduation, post-graduation.
Yeah. So you want?
Yeah, just like where did you do your, you know, schooling from? Where did you go for college? Where did you go for your uni, for masters?
Yeah. So basically, I went to school at the AMI school. That's in Karachi, and then I did my A levels from Lyceum, and then I went to Khan University for MBBS. Uske baad, I worked for a couple of years. Basically, I worked. So my friends and I, we started this mental health organization called Tazkeen. So I was there for a few years. And then I also worked at this maternal child health project called JPHEIGO. And then uske baad, I basically got a Fulbright for my master's to the US. So that was Harvard School, TH Chan School of Public Health. And master's mera basically health and behavior pe hai.
Oh, okay.
And I also.
No, you were saying something. that you
Oh
after
yeah, I was
that you
also
were
going to say
thinking?
that there's a course called Certificate in Humanistic Integrated Counseling. So that's a mental health course. So I did that from CPPD here.
Ah, yes. You mentioned that before as well. Okay, your certification. Okay, that's very interesting. So you, what year did you finish your MBBS?
So that was 2014.
Nice.
So like
Okay. And then
10 years
after,
ago.
so after you did your MBBS, you worked in, so Tazkeen, the foundation that you mentioned, was this like you joined in, or did you and your friend, as you said, did you collaborate and start this NGO?
So basically we started it. It was, we started sort of it as a volunteer project that we were sort of doing. So me, Taha Sabri, basically a class fellow at AKU, and then a couple of other people, we were sort of doing it voluntarily. And then we just got funding and it got registered. So yeah, that's sort of how that happened.
Wow. And what was your what was the objective of the scheme?
The objective initially was just to raise awareness. I mean, you know, in the last 7 years, in 7, 8 years, like things have changed so much. But in 9 years up to in the last 9 years, things have changed so much in terms of mental health awareness and just how much a part of it is in our regular conversations. But if I think back to like 2014, there was no awareness, there was no conversation. It was such a taboo thing, and like even for us, right? Like so for me, like I've dealt with these things in my family, and like you know I had my own anxiety or whatever, but I couldn't actually even recognize it, even being a medical student, just because like I didn't know how to apply all of the text that I was reading to myself, and I didn't really understand कि हमारी रोजमर्रा की जिंदगी में एंजाइटी के सिम्टम्स कैसे आ सकते हैं या डिप्रेशन के सिम्टम्स कैसे आ सकते हैं या जो भी राइट so I think the need was just for us going through these things personally and then realizing that the information was just not out there and wanting to get that information out there. So that was sort of the motivation. Yeah. And then it was very fulfilling actually having these conversations in the community because people felt the need for it, for sure.
And this was just like you were operating in Karachi.
Yeah, Karachi, थोड़े बहुत इधर, थोड़ा बहुत इस्लामाबाद में, थोड़ा बहुत लाहौर में, थोड़ा बहुत मुल्तान में, like just sporadic sessions here and there. Yeah.
And this was like, this is straight out of med school that you started, that the scheme happened.
Yeah, yeah. I mean, Taha was definitely like the full driving force for it, and you know, I was happy to sort of jump on board and yeah.
Okay. So, and then you also mentioned that you worked in JPHEIGO for a bit. So, can you elaborate on what you were working on at that time? Can you hear me? Okay. What about now?
I mean, I can hear you fine, but the video is still a bit like not great.
Okay. I can now see you and hear you perfectly as well, so I think we can just continue. Great. So, sorry, you were telling me about JPHEIGO.
Basically, it's John Hopkins Institute for Obs and Gynae, Integrated Education and Obs and Gynae. So basically, they would have different maternal and child health projects, and that were all associated with John Hopkins University. So the project that I was working on was MCHIP. It was a 5-year project. I joined the training evaluation department. So basically my work was, there were 15 districts in Sindh, and that the project was being rolled out in, and I sort of had to visit the health facilities in all of the different districts and see how well the interventions had been adopted, and yeah, just how well they were being rolled out and things like that. So basically monitoring and evaluation का मेरा काम था उसमें.
Okay, and so so you worked in Tazkeen, and after you, or were you doing both of those things simultaneously?
Yeah, sometimes simultaneously, sometimes pehle ek, phir dusra, just different things at different times.
Okay, so before I get into, you know, your Fulbright scholarship, I want to ask, so you graduated in 2014. What was it that made you not want to go into the clinical side? And what was it that, you know, pushed you towards joining these NGOs or these organizations? And can you elaborate a little bit on that?
So I am one of those MBBS people जिनके parents उनको MBBS में दाखला करवा देते हैं. So, you know, but once I got dakhla, I really appreciated it. I really enjoyed clinics. I enjoyed the interaction with the people. But I found the interaction a bit limiting. I like hearing people's stories, and I like hearing about their lives, and I'm not so interested in sort of biological management of things and all of that. I'm definitely more interested a little bit more in sociology and anthropology and in those things. Psychology, right? And those are very detailed conversations to have with people, as opposed to sort of conversations that you might have within a medical clinic. So I think that was one of the primary reasons that I wanted to interact with people. I wanted to be in the community. I wanted that type of engagement. Yeah.
Did you, and so based on that, was psychiatry ever an option for you? If not, is that still something which, you know, you have a very detailed and in-depth connection with your patient rather than just कि clinic में बंदा आया and आपने उसको presenting complaint क्या है आपकी?
I mean, psychiatry, honestly, I did consider it, especially last year. I was thinking about it, you know, what if I just go back and just do residency, and just do psych? But I just don't, I guess, don't feel the pull so much. There's, yeah, I just don't feel the pull so much. I think I'm, if I do further padhai, I think it's going to be more towards clinical psychology or something like that, rather than psychiatry. And that's just the nature of the padhai that I want to do, because so your video is frozen, but I'm just continuing speaking because I think yeah. I think it's also the nature of the padhai, right? So psychology may, the way that the sort of things that you would go in depth into within psychiatry would be different from the things that you would go in depth into in psychology. And if I think about what I want to study, then that's a bit more towards psychology than psychiatry. But मैं सारे अपने फैसले जो है ना mood पे करती हूँ, so you know, there's also other things to factor in, and
yeah,
not everyone has to make decisions that way.
Yeah, no, for sure. But I think that is also a very important thing to listen to yourself when you're making these kinds of decisions, because sometimes you don't push yourself into doing something just because this is meant to be, you know, this is what everyone is saying is the right thing to do.
Yeah, and then you have these sort of idealized, yeah, sorry, continue.
No, go on.
These sort of idealized things around what a certain profession might be or what the day-to-day might be, but I think it's important to sort of look at what does the padhai for this involve? What is the pace of work in this field? What is sort of the day-to-day look like? And how well does that align with me? I think that's really important.
Exactly. Okay. So, we talked about कि आपने काम क्या किया था once you finished your med school graduation. What was it that kind of pushed you to apply for a MPH degree? Can you elaborate on that?
Yeah, so I was working at a project on Tazkeen. The project was basically integrating social and emotional health curricula into schools and just making them accessible to communities. And I think I just wanted to sort of train myself and prepare myself for that work. And I think if you're considering a Fulbright, then also that's the way to sort of think about it. Is sort of to have a project in mind that you want to develop skills for, because that allows you to sort of write your essays and statements in that way, which really helps, which is part of what they look for. So yeah, that was the thing.
So by that time, and so yours was not purely just an MPH. It had what was your full degree again? It had it was Master's in Public Health, and then it had for the subsection
in Public Health. Yeah, Master's in Public Health, Health and Behavior.
Health and Behavior, exactly. So by that time, you had decided, that whatever work that you were going to do was mental health was the umbrella that you were basically going to be working in. Yeah. Nice.
Yeah.
And I think that realization is that a realization you had prior to you working in the different organizations that you had?
You know what? I think it's a realization that I've come to again and again over the last few years. So जब Tazkeen का शुरू हुआ तो उस वक्त I was enjoying that so much that I was like, okay, definitely mental health. Then I went for my master's. There were so many other things that were interesting. This is social policy and the impact on health was really interesting. And I explored that for a year after coming back. But then I was like, no, like, it again came to a point where I had to choose one or the other. And develop myself in that direction. So then I chose it again. So it's definitely like a recurrent choice than a one-time choice.
I think recurrent इसी वजह से है because that's like your main, goal that you're working towards. But what I also find, what I find interesting also that regardless of this is what the main thing that I want to do. And I think this is a big plus for public health is that you have an opportunity to kind of delve into, चलो ये भी कर लेते हैं और इसमें भी थोड़ा dabble कर लेते हैं और ये भी पढ़ लेते हैं, which I felt that anyone pursuing purely clinical, they are to some extent restricted, But in public health, you have that flexibility where just because you're an expert of one thing doesn't mean that there aren't other sections or other sectors that you can't work in,
Yeah, and with public health, I feel like there's two sort of streams that you're an expert in, right? So there's a methodology that you're an expert in that might be whether that's epi, whether that's epidemiology, whether that's biostatistics, whether that's behavior change interventions, whether that's qualitative studies or quantitative. And then there's the health related stream. So whether you're into nutrition or whether you're into like mental health or maternal child health, right? So even, even if you are mental health qualitative, which I am, I can still do like injury qualitative because I still also have that qualitative skill set. So there's also room to play around in that way. So that's also nice. That's also fun. Yeah,
definitely. So tell me, stand जो है ना, for some reason it keeps falling. Okay. So tell me a little bit about your master's and how that experience was for you.
I mean, that experience was really amazing. I think my favorite thing about it was कि एक Green New Deal का town hall हो रहा था. And, you know, I'm someone who believes in like a very grassroots sort of democracy and like seeing that sort of in action where we don't usually have those things. Town halls हमारे इतने active नहीं होते, अगर होते हैं तो उनकी conversation बहुत ही अलग type की होती है. So just seeing like the actual mechanics of a democracy that has its processes a bit more sorted than we do, that was just fascinating. And like that sort of gave me an understanding that I might not have had otherwise of the fact that these systems can actually work and how they're meant to work. Yeah, so I think that was the most interesting thing. And then our professors were also so amazing. There were people who like were part of the Environmental Protection Agency or were chairing it or just like really had like really solid track records of getting things done. So it was just, even if I like I'm not into environmental health, just having that exposure to that mindset was really nice.
Very interesting. So like when we talk about MPAs, obviously that's a very holistic degree, right? आप उसमें हर चीज़ ही cover हो रही होती है. So what domains were जो आपका health and behavior वाला जो section था within your degree, what was covered in that? Like just a general overview.
Yeah, I mean they went through a bunch of different like types of behavioral change interventions. You know, you sort of एक उसमें ये theory होती है कि readiness to change कितना है किसी का. So you can have people that have different levels of readiness to change. Then you go a little bit into how people make decisions. Then a lot of it is just general epi, bio, stats. Even in a health and behavior degree, a lot of it is questionnaires कैसे develop करने हैं, screening tools कैसे develop करने हैं, qualitative data कैसे collect करने हैं. A lot of it is just the functionality of research. Yeah, and then जो behavior change के elements हैं वो थोड़े से decision making कैसी होती है, उसकी अपनी कुछ theories हैं, कुछ models हैं that we would go into, and
so
intervention.
Right. So like so my question is more in terms of now, okay, like when you're applying or when you were applying for your masters, because यहाँ पे जो हमारे जिस तरह masters के programs हैं, you're not you're restricted to and usually like they're offering singular courses, right? So say if you have a MSc Epi Bio, whatever courses are within that, those are mandatory for you. You can't pick and choose what courses you want. So when you were doing your masters or applying for them, you chose your health and behavior, but then you had modules of health and behavior which were separate, or not separate, but those were not taken by everyone who was doing an MPH degree, right? So how does that work? Like how before you're going for your masters, generally this is what I've noticed when you're going for your masters abroad, is that you can pick and choose courses rather than like a degree that you want to go for.
Yeah, and this was similar. So my degree was health and behavior, but I was also the mental health stream. The mental health stream उनका officially तो launch नहीं हुआ था, उससे अगले साल launch हुआ officially. But while I was, the courses launch हो गए थे basically. So I took a lot of mental health courses. I took a lot of mental health and LMIC courses. So that was the bulk of my degree. And उसके अंदर भी फिर I had choice, right? Like कुछ उनके core courses थे. और बाकी there was a huge list of courses that I could choose from. उसके अंदर global health के भी courses थे. अलग जो population reproductive health का track था उसके भी courses थे, अलग अलग tracks के courses थे. So I focused on जो मेरे core थे वो मैंने mental health का लिया. मतलब जो core थे वो तो थे, उसके अलावा मैंने जो लिया वो ज़्यादातर मैंने mental health के लिया और एक qualitative research का, because those were my interests.
Very interesting. So did you I think was your master's, was it a thesis based master's or a practicum based master's?
Mine was a practicum-based master's, and the practicum was sort of assessing student needs from on-campus counseling services. So uske andar we just did focus groups and IDIs and things like that, and reviewed like existing service platforms.
So qualitative methodology, you are 100%.
Hundo, don't ask me to do Excel sheets, yaar.
Sahi. So did you work in the US in any public health organization like just a placement hoti hai or generally or post graduation?
No, I didn't. So basically,
Or even like an internship or anything.
So basically, जो मेरा practicum था, that was by NAMI, so the National Alliance for Mental Illness. That's like a large-scale governmental US public health agency that specifically deals with mental health. So my practicum was with them. But जो उसके अलावा literally and also Fulbright की वो भी हाँ और Fulbright का वो भी होता है that you have to do 2 years, so you can apply to change it and things, you can apply for extensions or whatever, but I had work here that I really wanted to get back into, like the skiing का जो सारा काम था, तो yeah, I chose to not go that route at that moment.
Okay. So after like gaining experience in the US, and as you mentioned, many town hall meetings dekhi, and things are very different. How would you compare public health there to public health here?
I think it's easier to be an idealist in public health there. I think यहाँ पे आपको थोड़ा सा अपना idealism बरकरार रखना मुश्किल होता है. It's emotionally, morally, ethically much more challenging here, and you have to make the types of decisions that you have to make are harder than the decisions there. And that's not to say कि वहाँ पे challenges नहीं है या वहाँ पे मुश्किलात नहीं है. But just the level of it is very, very different. And I think here you have to understand and really pick your battles. So you can't, you can't sort of gutto on every ethical, moral thing that you might want to sort of dig your heels into the ground on. You can't, otherwise you would not be able to function. So you really have to pick your battles here.
So, but would you say that, the kind of, obviously the challenges in both those places, in both here and in a high income country are very different, right? But here, do you see there actually being solutions to the, say, mental health challenges that are present here? Or is it just a constant battle to even, get started?
I think solutions to hai. I think expectations or timelines apni realistic rakhni chahiye. So I think things are moving forward within mental health. They moving forward in, are they hitting exactly the spots that they need to hit? No. Is it happening at the pace that it should happen at? No. Is it happening at the scale that it should happen at? No. But like it is still happening, and it will take time. It will take time. हमारा सबसे बड़ा मसला जो है ना वो capacity का है और trained individuals का है, and that doesn't happen overnight. Especially scaling, especially things that require long-term degrees. And there are efforts that are happening to sort of task shift and train lay health workers, community health workers, teachers, things like that. But again, for example, lady, and for people with mild to moderate depression, those might actually work. So there are those things that are in the pipeline. And then I think once it's rolled out, then over time quality can improve, reach can improve, things like that. But yeah, I would say there's it's not hopeless.
Yeah, okay.
Yeah.
That sometimes it does feel like that, but it's very refreshing to hear that from someone who's actively working. And like I'm just a student right now, but for you who's been working in the field, it's nice to hear that. It's encouraging. Okay, just because there are a lot of roadblocks, there is light at the end of the road still.
Yeah. Yeah. I think the hardest thing is definitely accepting the reality of the roadblocks. And the reality of certain situations here. Just corruption is a reality, and it's a reality in academia, it's a reality in everywhere, right? Exploitation is a reality everywhere. So given those things, the fact that people are still pushing forwards and people are still supporting projects when they see that there is value in them, it just makes you realize that things aren't always people aren't black and white, and you have to sort of
for sure.
Yeah. There's hope, but there's also idealism थोड़ा सा tone down करना पड़ता है.
Yeah. So after you did your masters and you said I came back. So how long has it been since you've been back from your masters?
So I came back in 2019.
Oh.
So 4 years now.
Okay. So 4 years, yeah.
Almost
So
4 years.
What has that journey been like since you have a master's degree? So what has your journey in public health been like since?
It's been interesting. It's been a lot of exploration. So it's been exploring what setup I want to work in, whether I want to work in academia, whether I want to work in startups, whether I want to work in NGOs. It's been exploring sort of what health topics I want to deal with, what type of research projects I want to work on. So it's been a lot of exploration. I would say कि masters के बाद आपकी exploration or learning definitely नहीं खत्म होती है. And I think I'm still in that process. I'm still exploring different ways of working, different projects, different things.
So do you think, because you were also working pre your degree, so in terms of job opportunities, has anything changed pre and post?
Yeah, so I think job opportunities, just the truth is that having a brand name degree helps really. AKU was also a brand name degree. So it hasn't changed so much. But jo of course space caves and the sort of role that I get hired for and the position, those have changed.
Mm-hmm. Okay, makes sense.
So it's one of my goals in life.
Okay. Right. That makes so that the reason I asked that question is because जब भी आप any job opportunity that you're looking for, and I'm saying this as a community medicine resident, right? There are certain degrees which either are not recognized or certain people aren't aware of this, right? So having और हर जगह किसी भी जॉब एप्लीकेशन में आपको नजर आएगा जी क्या चाहिए तो MPH चाहिए. So in those regards, it's having a degree, and obviously having a degree from a reputable place, I would assume that there are more opportunities that you can at least apply for.
Yeah, हमारा जो public health sector है ना, it is honestly a little bit biased towards medical degrees also. So because I
Yeah.
had already had a medical degree, it was easy to get jobs in the sector. But for sure, if you have a bachelor's that's not medical, then a master's is essential or
Makes
helpful
sense.
at least. Yeah.
So once you came back, you joined Tazkeen again, right? Like you resumed whatever work that you were doing with Tazkeen, right? And
Yeah, yeah,
then,
yeah.
and Tazkeen was like on the ground within, like you were covering Karachi, or were you also going to the different cities?
So mostly we were based in Karachi. Mostly it's based in Karachi. There were 2 or 3 communities. So when I was there, जो हम project कर रहे थे, that was based in Orangi, Leari, and Model Town. So then basically we were training Sehat Kahani's community health workers to sort of deliver mental health curricula and workshops and things in schools and within their own clinics and stuff. So that was the project.
Nice. That's very cool. And since you had started doing those sessions with them, did you have noticed any difference, any change?
I
I
mean,
know it's very easy to say कि behavioral change हुआ या नहीं, which is a very difficult thing, but like कुछ भी उसका result, because now it's been I think about 3 years since you had been doing that.
yeah. So the thing is that basically the component that we were sort of addressing was basically social and emotional awareness, right? And we were sort of the workshops are sort of 1-off, 2-off sessions. So it's sort of great to sort of light a little spark and sort of throw that motivation for understanding these things there. But of course, for longer term change, you need longer interventions, and you need to really study what works in this context to bring about longer term behavioral change in mental health and in social emotional skills. And वो उस level का project अभी तक कोई नहीं हुआ है. But just from the sessions, they were so cathartic, and people shared so much, and they released so much, like things that they never even talked to anyone else about. But that had been impacting their lives and their relationships and things like that. So there was definite change, and there was definite opening up and value in the sessions for sure. Yeah.
Because we hear very less about, अब फिर भी ज़्यादा हो गया, but फिर भी there's still like this taboo, or people not considering mental health as an important thing. So it's refreshing to hear, going into communities like that. So what I wanted to ask you was, as a graduate, or generally after you've gotten a certain degree, what are the routes that a student can take once they've graduated?
With an MPH?
After the MPH, yeah, not undergrad. After they have a public health degree, let's say, whether it be a bachelor's in public health or a master's or a residency. What different routes are there that one can take?
So you have the whole NGO sector. You can work in that sector. Abhi tak, the majority of the work being done by that sector is more maternal child health. There's some work being done by that sector that's health systems, so improving the quality of hospitals in general, especially in rural districts. So there's that work. Mental health ki bhi, there are a few, like 3-4 NGOs now. So there's a bit more scope in that. And then uske alawa, so the NGO route is one. Then academia, you can work with HDRF, for example, or AKU, or Health Systems Academy, Health Sciences Academy, HSA. Yeah, Health Services Academy. So, or other universities. So that's more research. जो अगर आप academia में आते हैं, then it's a bit more desk based. It's a bit more writing papers. It's a bit more grant applications. And then rolling out and you still go into the field and you still roll out projects, but more of your time is sort of around reviewing and developing your own learning and developing your own academic know-how. In the NGO sector, it's much more field based. It's much more community based, and it's much more program delivery, and you're not generating knowledge so much. Then the startups are again more field based, more program implementation, more delivery. The sort of trade-off between going to an NGO versus a startup is that NGO still follows grant cycles. So you still have projects that are renewed every 5 years, and you still need grant submissions, and you're still sort of based on donor agency agendas, which might not align with your own local agendas. But the thing is that because there is conversation happening within the West and locally also, the agendas are aligning more and more now than did previously. Like, I feel like Western academics are much more sensitized to like local needs now than they were before. But of course, and you can see that process happening, you can see that shift happening, but of course it's still not local agendas, and startups are a bit more really on the ground decisions being made and things like that. So I think I've covered 3 parts.
Yeah, so academia, startups, and NGOs. Right?
Yeah. And then there's also like corporates, like things like Mary Stopes, which follow a more corporate model, which again is similar to startups in that like the decision making is a bit more on the ground.
Right. Someone mentioned, what about the administrative side of public health? I think that's.
I mean, yeah, it's like a lot of administration for sure. For sure.
Yeah.
There's you can't escape that if you're doing public health.
All 3 of these things that you mentioned, they have that. But I think a lot of public health is also health management, which is also an option. And say if you have a clinical background, then health management comes in for hospitals, right? Hospital management, which is also public health. So yeah, uske liye log, instead of an MBA, a lot of people end up doing an MBA for that, to get that insight after their clinical studies.
Yeah. So I've explored a bunch of sectors. Hospital administration is not something that I've explored, so I don't know if I can speak to that.
Would you like to?
No, but I also won't say that, because anytime I've said कि मैं ये नहीं करी, that's what I end up doing. So
I like that. लेकिन try हर चीज करनी चाहिए. So then you know what you don't want to do.
Yeah, for sure. I mean,
what if मैं ये कर लेता या मैं कर लेती.
Yeah, and you learn. You have pre-conceptualized ideas about how something's going to go, and like that's not reality at all most times. So it's good to explore.
Yeah, and I think it's just when you have experience and insight from various different things, whatever you actually end up doing, all that does come into work. Like, it does play a very big part. Okay, so you worked in politics. So yeah, I just wanted to comment on that. Politics is everywhere in public health, and that's sort of what I was saying about, like, you have to let go of your idealism just a little bit and pick your battles, because otherwise you're just going to be exhausted. And I still see people able to make change in spite of the politics and in spite of all the guns. Yeah, for sure, definitely. Can you hear me properly? Because आपकी आवाज़ थोड़ी सी अभी कट रही थी. I don't know if it's my end. I can't hear the break हो रहा है, but I can hear it. Okay. So I think we have touched on this, but I just wanted to ask this as a specific question. Is, in all the work that you have done within Pakistan, what do you feel like has been, when it comes to your work, what has been the biggest challenge that you have faced? The biggest challenge, I think, is more internal than external. I think it's just figuring out just
what's the right style of work for me, what's the right pace of work for me, what's the right sort of, who are the right supervisors for me, or who are the right, like, who's the right team for me. So I think until you get to that space, it feels very challenging. And then when you sort of find something that's exactly right, then you go faster and you achieve things faster. And then you sort of also, yeah, then you might need to refine that at some point. So I think that's the challenge. I think uske alawa challenging to har cheez hi hai, and all types of works are challenging. You just need to find the challenges that feel okay for you to take on, I guess.
That's true. I like that too. And has it also been challenging for you to find a mentor in the work that you've been doing?
I mean, because public mental health as a just workforce in Pakistan is not fully developed, right? Like, so you really don't have the middle tier, and you have some people in the upper tiers, but like very few people. And of course, the upper tiers, they don't have that much time. Some of them are close to retirement, and like obviously they don't have that much time, and like so they're not able to mentor in the way that like a middle tier would mentor. So that I think that missing middle mentorship tier is a big gap and is a big challenge, especially in public mental health. Or domains mein hai middle tier bhi hai, but like public mental health mein to bilkul nahi hai. And I think I've been lucky to eventually find like a lot of people in that who have guided me, but it took time. It took time. And it was a struggle until I found those people.
Yeah. And I think that's generally one thing that really will advance anyone in their career is if you find the right mentor, But it's also, as you mentioned, it is mental health mein khair kuch zyada hi challenging hai. But generally, I feel like it's very challenging to find someone who will mentor you, Again, because there aren't any streams or areas of guidance you can have otherwise. So that presence of a mentor is very important. For sure. So it's 5:50, so we have 10 minutes. So I'll ask you one last question, and then there's a few questions that people have asked, so then we'll address those. Yeah. So my last question to you is, what is the advice that you would like to give to people who are pursuing public health?
I think my advice would just be it's very easy to get caught up in sort of the career race. Like, don't do that. Find a project that speaks to you. Find something that gives you meaning, and try to keep that your priority. And try to be guided by that. Because I think that's the way to make change, and otherwise you get just get stuck in that career administrative ladder, and nothing really gets done.
Yeah, that's true. And I think again, when it comes to public health, you have the opportunity to not be restricted. So it doesn't just वो rat race follow करने की इतनी need नहीं होती है, you can still kind of experiment.
Yeah, and like even when you make decisions around like what degrees to choose, what things to study, like just do the things that are interesting for you, because it is a lot of lifelong studying. It is a lot of lifelong professional development. It should be things that you're interested in. Otherwise, it's difficult to move forward.
Great. So we have a question by Jangir Khan, and he's asking that what have you concluded from your experiences? Is digital solutions to mental health problem a viable option in LMICs or not?
ये तो इस पे तो मैं narrative literature review करके बता सकती हूँ. You know, I can't. I don't want to get.
This is a research question for you to work on and get published.
I mean, if you want to like do a systematic review on it, sure. It just common sense wise, yeah, I think a solution would need to be digital. There's no way, there's no other way for it, because अगर आपका 400 psychiatrist है और सारा कराची इस्लामाबाद लाहौर में है, then you need some sort of you know, you need digital health to build referral pathways at the very least. And
do you know of any interventions that are ongoing, digital interventions that are ongoing right now in terms of mental health?
Yeah, I mean, AQ के अंदर ही CHS में, like the M Parishan project, which Dr. Fawzia Rabbani is sort of doing. That's such an interesting intervention where like you have an app where psychoeducation is built in. It's actually videos that Tazkeen developed that are built into that app, and you can like the CHW go house to house, and if someone was trained to have mild to moderate depression, then they psychoeducate them through the app. So then the LHW doesn't need to be trained in mental health in that way. She just needs to know how to work the app. So you know, that's one way in which like digital applications are sort of bypassing the HR or resource gap in that way, and helping with task shifting. But uske alawa bhi, like, you know, there's ways, especially if someone has literacy and phone literacy. So urban areas mein app based therapy ka scope hai, you know, like CBT, and there are people who are testing that out, bots ke through ya jiske through. So us tarah se bhi hai. And then of course, like there's different ways basically that you can use to integrate, but I don't think it can happen without technology.
Definitely. Okay, and then someone is, Dr. Roman has asked if you can elaborate. I think this requires a whole other session, but it says, can you please share the process of achieving a Fulbright scholarship?
Have friends that have already done it so they can guide you. No. Basically, find people to guide you for sure. Yeah, just get some work experience. I think someone's
achieving a Fulbright scholarship is not an easy feat at all. At all. I know way too many people didn't apply, unfortunately nahi ho paya. So, you know, you're not called a Fulbright scholar for no reason. So it's...
Thank you, Amna. You're very good for my self-esteem.
It's true.
Yeah, I think the advice is just to really, so someone's also asking, is it a good idea to apply right after undergrad? And I would say no, definitely get some work experience first. Get a very solid problem that you want to solve. Identify specific skills that you need to learn in order to solve those problems, and find a degree that aligns with that. And then, because that showcases that you've actually put thought into what you want to do, and you're not going to sort of waste that opportunity of, like there's actual change that you can envision, that you just need their support to be able to do, right? So that's what you want to showcase. So the statements are really important. GRE se dare mat, TOEFL se dare mat. You don't need amazing scores on GRE and TOEFL to be able to do it. You need a good statement of, you need a good personal statement, and you need a good study objective statement, and you need to do well in the interview. And so for all of those things, it's really important that you don't jugaad it, and you don't BS your way through it. Basically, you need to really have a solid idea and plan, and that you really care about. That's the, yeah.
Yeah, for sure, for sure. And one last thing which I did mention, sorry, I forgot, is Dr. Maria is also a trained, you do yoga sessions, right?
Dance Mandala.
Dance Mandala.
So many
yeah.
Yeah.
So
So it's a meditative. Yeah.
Please tell me how you merge those two factors of your personality together.
I mean, it's a full. It's. I think they're very much on the spectrum, right? Like,
Exactly.
mental health में सारी अब जो conversation जा रही है वो ये जा रही है कि you need to sort of work with the body as well as the mind. So body-based practices are essential. So if you're someone who's had depression, had anxiety, or even like just if you don't have any diagnoses or whatever, even if it's just daily stress, having a bodywork practice, whether that's yoga, whether that's Tai Chi, TRE, kickboxing, dance, whatever, is essential, and especially if it's by a facilitator who's sort of aware of different mental health concepts. They can really help integrate. So basically, mental health concepts क्या होते हैं? वो कुछ thought processes होती हैं that are healthier than other thought processes which are not healthier. So if a yoga instructor, for example, is mental health aware, then they'll be giving you the thought processes and they'll be helping you rewire your brain to a healthier brain. So that's why it's important to have a bodywork practice, and it's important to have a facilitator who's mental health aware, and who's not using shame, and who's not using those types of things to motivate you. So yeah, for me it's just like mental health की दुनिया के अंदर से ही मुझे dance mandala मिला है. They're not.
When I heard about the fact that you do this, I was like, yeah, that makes sense. If she wouldn't do it, who else would? For sure. But no, I think it's great that it though yes keeps you active, but also completely integrates with the work that you're doing. So I think that's brilliant. So yeah, that would be the end of our session, and thank you so much, Dr. Maria, for joining and also providing so much valuable information, which I think जितने भी लोग आज आए हैं उनको will help them a lot. So yeah, thank you again.
It was a pleasure, and just happy to be here and happy to give Mufti Mashwari anytime.
Yes, and everyone, please go follow her and her page and go join all her classes.
Yes, and please, KWF Karachi Wellness Festival is happening 4th and 5th February. My session is 2 to 3 p.m. Dance Mandala if anyone wants to experience it. But look at the full schedule because there's so many amazing things that are just on offer that weekend. And thank you everyone that sort of stuck around and listened to this whole thing. I really appreciate it.
Okay, thank you. And this will be on my page, and also Dr. Maria's page, so you can listen to it whenever you also want to listen to it. Okay, I think we can end the session now. Thank you so much, and I will see you soon.
Thank you, Amna. Take care, everyone.
Okay. Bye.